This Medical Minute sponsored by Avera.
Schools in North and South Dakota are using Avera eCARE to help students if a school nurse isn't available. In tonight's Avera Medical Minute, KSFY's Jill Langland explains how Avera eCARE has helped patients simply by using a camera and the internet.
You could make the more than 7-hour trek to mid-central North Dakota.
I'm Nurse Sheila.
Or you can talk to a medical professional with Avera eCARE.
I'm one of the nurses and we like to help kids.
Several miles separate Westhope and Velva public schools and a hospital. With that, connecting with eCARE
Walk towards the wall
can help these schools out.
Nursing care is not widely available in small schools. The opportunity to be able to have this resource was just something we couldn't pass up.
And within seconds, the hours-long driving distance doesn't seem that far.
We do fist bumps on the camera, high fives.
Avera eCARE services 20 different schools in both North and South Dakota.
eCARE itself is more like kind of a technology hospital where we do a lot of different service lines, everything from ICU to emergency room, to pharmacy, behavioral health. And so school health is embedded within that kind of eCARE or technology hospital.
And finding an answer to a student's ailment happens faster than you think.
It is very easy. You can pretty much walk somebody right through it. You get on and they either tell you to pick a certain provider or to see the first available. And once it finally starts connecting, it's only seconds before you're actually connected to them.
Both have the equipment.
This is the otoscope. This can be used for checking their ears, checking the throat,
and the knowledge to help students.
We do the direction, but these are called peripherals, and they help us have the right knowledge so that then when we call the parents after we're done with the visit with the kid, we can visit with the parent. This is what we saw. You know, it's always the parents call what they want to do, but it gives us a little better option of how to guide them.
eCARE nurses also use these web chats to help guide students, parents, and school administrators to make the right choices when deciding if a student should go home. But it's the unlikely friendships that are formed due to the careful and attentive care done by e-nurses.
We've had a great relation with Sheila and her staff. Even though we're hundreds of miles away from them, when I walk in and visit with Sheila, call them, it's very personal, just as if they are our own personal school nurse in our building.
For your Avera Medical Minute, I'm Jill Langland, KSFY News.
Some students opt to use Avera eCARE to take an issue up with someone outside of their school instead, especially at smaller schools. For more information, you can call 1-877-AT-AVERA or head on over to ksfy.com and click on Health.